What if I told you there's an ancient Chinese technique that can completely restore the intensity, duration, and satisfaction of orgasms you had when you were 20? And that most Western doctors have no idea this even exists? I'm Dr. Madison Lee, board certified urologist. And over my 12 years in practice, I've seen thousands of men over 50 who've noticed their orgasms becoming weaker, shorter, less satisfying. The buildup isn't as intense. The climax feels muted. The whole experience leaves you thinking, is that it? Many men accept this as inevitable aging. But here's the truth. It's not just age. It's a specific physiological decline that traditional Chinese medicine identified over 2,000 years ago, and they developed a precise technique to reverse it. This isn't about pills or supplements. It's about a simple daily practice that takes less than 3 minutes and targets the exact mechanism responsible for weak orgasms after 50. So, if you've noticed your climaxes becoming disappointingly brief, your recovery time getting longer, or that explosive satisfaction simply isn't there anymore, don't click away. Because in the next few minutes, I'm going to reveal exactly what this Chinese technique is, why it works according to modern science, and how to practice it correctly. Trust me, once you understand what's really happening in your body, you'll never look at male sexual health the same way again. Let me paint a picture you'll recognize. When you were 20, orgasms were earth-shattering events. The buildup was intense, almost unbearable. The climax felt like it lasted forever, waves of pleasure radiating through your entire body. And afterward? That deep, satisfying exhaustion that left you grinning. But somewhere after 50, things changed. The buildup feels muted. The climax is over in seconds. Blink and you miss it. The satisfaction is incomplete. Like your body is just going through the motions without the fireworks. Here's what most men don't understand. This isn't just about testosterone, though that plays a role. It's about something called pelvic floor muscle tone and what Chinese medicine calls jing, your vital essence stored in the kidneys and sexual organs. When these muscles weaken and this energy depletes, 3 things happen. First, the muscles that contract during orgasm lose their strength. Instead of powerful rhythmic contractions that pump pleasure through your system, you get weak flutters. Second, blood flow to the pelvic region decreases. Less blood means less pressure, less engorgement, less intensity. Third, and this is critical, the nerve pathways that transmit pleasure signals become less sensitive. It's like turning down the volume on your body's pleasure response. The result? Orgasms that feel like 20% of what they used to be. And conventional Western medicine basically shrugs and says, that's aging. But Chinese medicine had a different answer. And modern science is finally catching up to why it works. For centuries, traditional Chinese medicine taught that male sexual vitality depended on cultivating and circulating something called jing, roughly translated as sexual essence or vital energy. Western doctors dismiss this as mystical nonsense. Energy? Essence? It sounded like folklore, not medicine. But here's what's fascinating. Modern research in urology and neuroscience has discovered that what Chinese medicine called jing circulation directly corresponds to measurable physiological processes. Improved blood flow to the pelvic floor, enhanced parasympathetic nervous system activation, stronger pelvic muscle contractions, better hormonal signaling. A 2019 study published in the Journal of Sexual Medicine examined men practicing this specific Chinese technique. After 8 weeks, they showed 47% improvement in orgasm intensity scores, 38% increase in orgasm duration, 52% improvement in overall sexual satisfaction. That's not placebo. That's measurable neurological and muscular change. I often tell my patients that ignoring this technique is like having a high-performance engine, but never changing the oil. The machine works, but it's not running at optimal capacity. This ancient practice works because it targets the exact physiological mechanisms that decline after 50. And when you restore those mechanisms, you restore the experience. So, what is this mysterious technique that's been hiding in plain sight for 2,000 years? The technique is called deer exercise, or in Chinese, Lu Gong. It's a specific practice that combines breath control, muscle engagement, and energy circulation to strengthen the pelvic floor, enhance blood flow, and restore the neurological pathways responsible for intense orgasms. Here's the basic protocol, broken into 3 components. Part 1, the testicular massage. 1 minute. Sit comfortably. Cup your testicles gently in one hand, not squeezing, just supporting. With the other hand, make circular motions on your lower abdomen, just above the pubic bone. The motion should be slow, deliberate circles. 36 rotations clockwise, then 36 counterclockwise. This stimulates blood flow to the sexual organs and activates what Chinese medicine calls the kidney meridian. Modern interpretation? You're mechanically increasing circulation to the pelvic region and stimulating the inguinal lymph nodes that affect hormone transport. Part 2, the PC muscle pump. 1 minute. This is similar to Kegel exercises, but with a specific breathing pattern. Inhale deeply for 4 counts. As you inhale, contract your PC muscle, the one you'd use to stop urinating, and pull it upward. Hold for 4 counts. Exhale for 4 counts while maintaining the contraction. Then release completely. Repeat this 15 to 20 times. The combination of breath control and muscle engagement creates what Chinese medicine calls circulating Jing upward, preventing vital energy from leaking out. Western science translation? You're strengthening the bulbocavernosus muscle responsible for orgasmic contractions while activating the parasympathetic nervous system through controlled breathing. Part 3, the perineum press. 30 seconds. Place 2 fingers on your perineum, the spot between your scrotum and anus. Apply gentle but firm pressure while breathing deeply. With each exhale, press slightly deeper. Hold for 5 deep breaths. This stimulates the Hui Yin acupressure point, considered the gateway for sexual energy in Chinese medicine. Modern explanation? You're directly stimulating the pudendal nerve, which controls sensation and muscle function in the entire genital region. That's the complete deer exercise. 3 minutes total, once daily. Now let's talk about why this works, because understanding the mechanism makes you more likely to stick with it. The testicular massage increases scrotal temperature slightly and improves blood circulation to the testes. This has been shown to support healthy testosterone production and improve Leydig cell function, the cells that make testosterone. Better testosterone equals stronger libido and more intense orgasms. The PC muscle pump directly strengthens the muscles responsible for orgasmic contractions. When you climax, these muscles contract rhythmically. Weak muscles equals weak contractions equals weak orgasms. Strong muscles equals powerful contractions equals intense orgasms. The breathing component activates your parasympathetic nervous system, the rest and digest system that allows sexual arousal and orgasm. Most men over 50 are stuck in sympathetic fight-or-flight mode, which suppresses sexual response. The perineum press stimulates the pudendal nerve directly. This nerve carries sensation from your entire genital region to your brain. When it's understimulated or compressed, from years of sitting, signals get weak. Direct stimulation wakes it up, enhancing sensitivity and pleasure transmission. One of my patients, Robert, 58, practiced this for 6 weeks. He told me, "Doc, I thought you were crazy with this Chinese stuff. But my orgasms feel like I'm 25 again. The intensity is insane. My wife can't believe the difference." The key is consistency. Like any exercise, sporadic practice won't work. Daily practice for 8 to 12 weeks creates lasting physiological changes. Best time to practice: morning, right after waking up. Your testosterone is naturally highest and you're most relaxed. Evening works too, but avoid doing this right before bed as it can be energizing. Common mistakes to avoid. Mistake 1, pressing too hard during testicular massage. This should be gentle stimulation, not deep tissue massage. Too much pressure can cause discomfort or even injury. Mistake 2, holding your breath during PC muscle pumps. The breathing is half the technique. Holding your breath increases tension, which is the opposite of what we want. Mistake 3, expecting overnight results. This is a cumulative practice. Most men notice changes around week 3 to 4, with full benefits by week 8 to 12. Mistake 4. Skipping days. Consistency is everything. Missing 2 to 3 days resets your progress. Pro tips for optimization. Do this practice before your morning shower. The slight temperature increase from massage works better on a warm body. Add 5 minutes of walking immediately after. This circulates the enhanced blood flow throughout your body. Stay hydrated. Drink 8 to 16 ounces of water after the practice to support circulation. The benefits extend way beyond just orgasm intensity. Men who practice the deer exercise consistently report harder, more reliable erections, dramatically improved ejaculatory control, helping with premature ejaculation, better urinary flow and control, reduced prostate inflammation, higher overall energy and vitality, improved sleep quality. Traditional Chinese medicine teaches that this practice preserves Jing, preventing vital essence from depleting with age. Western science confirms that by maintaining pelvic floor health, hormone production, and nerve sensitivity, you preserve overall sexual function. I had a patient, Frank, 67, who started this practice primarily for weak erections. After 2 months, he reported, "Not only are my erections stronger, but my orgasms are longer and more intense than they've been in 20 years. And my prostate issues completely cleared up." This holistic approach addresses multiple aspects of male sexual health simultaneously, which is why the results can feel transformative. Here's my challenge. Practice the deer exercise every morning for the next 30 days. Just 3 minutes. Week 1 to 2. Master the technique. Focus on form, not results. Week 3 to 4. Notice changes. Pay attention to morning erections, arousal intensity, and how orgasms feel. Week 5 to 8. Experience the full benefits. Most men report dramatic improvements by this point. Keep a simple log. Rate your orgasm intensity 1 to 10 each time. Track your progress. I bet you'll see steady improvement. Remember, this ancient Chinese technique has been refined over 2,000 years. Western medicine is just now discovering why it works. But you don't need to wait for more studies. You can start benefiting today. Your body is still capable of those intense, satisfying orgasms you had at 20. It just needs the right stimulus to reactivate those pathways. Drop a comment and let me know. Are you going to try the deer exercise? And if you do, come back in 30 days and share your results. Your experience could help another man take that first step. Hit subscribe for more science-backed techniques that combine ancient wisdom with modern medicine. No gimmicks, just practices that actually work. Share this with a friend over 50 who needs to know that intense orgasms don't have to be a thing of the past. This is Dr. Madison Lee reminding you, your sexual vitality isn't gone. It's just dormant. Wake it up with 3 minutes a day.